Thank you. Okay, so over to you, Emma and Rory.
Thank you. Thanks very much. So good morning, everybody. I'm Emma Reardon, and I'm here today with my colleague and friend Rory Fulton, and we're going to talk about sensory trauma and the impact on growing, developing and learning.
Morning.
And on your screen, you'll either have us talking to you like we are now, or in a while we'll have a PowerPoint presentation that we've prepared. So I'll start off, I'll just share my screen and I'll run through what to expect. So we'll begin with Rory and I telling you a little bit about autism wellbeing, and before describing the background to how our work on sensory trauma came about. And then we'll switch to share our screen with you and give a presentation with slides, which will be the main part of the presentation. And this should take around 30 minutes and leave us 15 minutes for a question and answer session. So I'll just use this as an opportunity to practice the screen sharing. So we should be back to us now. So I'll start with briefly introducing myself. My name's Emma, and I'm fortunate to live in West Wales, where I'm surrounded by beautiful countryside and lots of lovely walks that I can have with my dog, Blaze, and with my teenage son. My professional career has been in the field of health and social care, and I spent many years as a registered manager of residential services for adults with a whole range of disabilities, and I've also worked in business development. But now I split my time between home educating my son, conducting my PhD research on perceptions of autism held within community mental health teams, and as a director of Autism Wellbeing.
Hello, my name is Rory Fulton. I'm one of the founding directors of Autism Wellbeing. My background is in primary education, academic research, and mental health advocacy. I count myself very lucky to work closely with Emma developing our resources, services, and practice at Autism Wellbeing. When you get in touch with Autism Wellbeing, Emma's the one who will respond on social media, and I'm the one who will pick up the phone or answer your email. Autism Wellbeing is a social enterprise, which means that, like a charity, we're not for profit. We're a small team of professionals who have found strength in our neurodiversity and in our collaborative way of working, whereby each of us works to their strengths. Within our team, we have lived experience of autism, dyspraxia, dyslexia, and ADHD. But we're not keen on labels, and of course each of us is so much more than our neurology. Work-wise in the team, we have professional experience in social care, speech and language therapy, psychology, teaching, research, and advocacy. Alongside our neurology and professional experience, each of us has their individual physical and psychological characteristics and life experiences. What unites us as a team, however, is our shared desire to find ways for autistic and non-autistic people to collaborate equitably and successfully. Towards this objective, our work focuses not only on collaborating effectively with autistic people and those alongside them, but also on changing how autism is understood and talked about. We want to reframe autism by using and developing language that draws on and reflects the lived experience of autistic people. Drawing on our collaboration with autistic people and their families, and also on our own lived experience, we know that the sensory processing experiences of autistic people are quite different to those of non-autistic people.
Okay, so every single one of us experiences the world through our senses, and those of us who are autistic often find that our sense receptors are working perfectly fine, but our brains processes sensory information differently. And there is often too little or too much information to process, or the sensory information may be distorted or unfiltered. So this could mean that two people in the same environment may be having completely different sensory experiences. And I'm sure this is something that most of us here today, have some experience of. And as autistic people, we've been showing the world through our responses, our words, our actions, our vocalizations, and our bodies that some of this sensory information is not only different, but it's actually painful and distressing. And it can even elicit an automatic survival response in our autistic bodies, where we show a fight or a flight or a freeze response to the sensation that our brain is processing as if it's a threat. So we may experience other sensory information in intensely joyful ways too. And we demonstrate this to the world as well. But the way that I and many other autistic people describe our sensory experiences is quite different to the way that clinicians and academics describe them. So I'd use words to describe my sensory experiences like joy, terrifying, blissful, painful, words like that. Whereas a clinician would use words like hyper or hypo-responsive to describe how I'm apparently over or underreacting to things. So they may say my love of a particular repetitive noise is an unusual sensory interest, or perhaps they may describe the way I experience the world as atypical. Of course, to me, these experiences are normal. But to the clinician that's observing me, who is most likely not autistic, they will consider their own sensory experiences as a measure of normal against which to compare my sensory experiences. And if they don't experience sensory input in the same way as I do, or if they couldn't imagine getting pleasure or experiencing pain from the same sensory experiences as me, they will likely pathologize my experiences and consider them a result of an impairment or deficit.
This is something that we at Autism Wellbeing feel strongly about. You can find numerous descriptions of autistic experience in videos, blogs, and autistic life narratives, which state clearly that the sensory experiences of autistic people are different to those of non-autistic people, indeed are at times traumatic. The experience of sensory trauma is therefore nothing new. Indeed, we describe it as being hidden in plain sight. What is new, however, is naming and characterizing sensory trauma. The physiological and psychological impacts of events and interactions that give rise to sensory trauma are comparable to those found in other types of trauma. Indeed, autism and trauma often present in similar ways. It's important to note that not every autistic person will experience sensory trauma, and that not all sensory events are traumatic. I'll share my screen with you now so I can tell you more about sensory trauma. Imagine an autistic person and a non-autistic person in a room together. All of a sudden, the door slams shut. Now, if the non-autistic person was me, and I was having a fairly average day, where I wasn't too tired or stressed, but was simply going about my business, that slamming door may make me jump, and I might look up to see what was going on. I might feel irritated or slightly annoyed because of the noise interrupting me. But most likely, I would settle down and carry on as before. For me, this is a proportionate response to a door slamming. Now let's consider the autistic person. If that person was Emma, an autistic person who typically experiences auditory input in intense ways, she may experience the slamming door as sudden, severe auditory pain. Just like me, her brain processes the noise and her nervous system instructs her body to respond. Like me, Emma doesn't even have to think about it. Her body responds automatically to the threat it perceives. Perhaps she cowers, or even drops to the floor and curls up in the fetal position. If anyone was close enough to Emma when that door slammed, she may even lash out and hit them. Emma's reaction is a survival response: fight, flight, or freeze. Each of us in this scenario has responded authentically and automatically to our lived experience. The reason our responses are so different is because we have different neurologies. Emma's reaction is not an overreaction, and she's not oversensitive. Her response is entirely proportionate to her experience, just like my response was proportionate to my experience. If I experienced something that my brain perceived as a threat, for instance, a firework going off in the room next to my head, I would likely respond in the same way that Emma did, with a survival response of fight, flight, or freeze.
The next 5 slides that we're going to share are all about the core characteristics of sensory trauma. And I'm not going to read out exactly word for word what's on the screen. The text on the slides is there for information. And we'll share each slide, give a moment so you can read it through if you wish to, and then I'll elaborate, or Rory will elaborate on what's written on them. So, sensory trauma may not necessarily come from the events we traditionally consider to be traumatic, things like abuse, war, disaster, and so on. And it can be difficult for non-autistic people to appreciate events that have the potential to cause sensory trauma. But just like in the example that Rory gave just now of the door slamming, events that have the potential to cause sensory trauma may arise from ordinary everyday experiences. Things like greeting your family for breakfast, having a meal, showering, brushing your teeth or your hair, or even driving in a vehicle. So the first core characteristic of sensory trauma is that it may be found in ordinary everyday events.
The second characteristic of sensory trauma is its latent or unapparent nature. All of us, autistic and non-autistic alike, live in an unpredictable social and physical world. The potential implications of this, however, are different if you're autistic. You might live from moment to moment in fear of experiencing sensory trauma. Not just being on the lookout for potentially traumatic events, but hypervigilant, body and brain activated and ready to pick up potentially traumatizing sensory information. Physiologically activated in this way, we experience the world as threatening and not at all a place of safety. For an autistic child, sustained, heightened vigilance may come at a cost to their development and well-being. Toxic stress can suppress the developing child's immune system and modify brain regions that are involved in learning and memory. In addition, toxic stress in infancy and childhood can lead to increased vulnerability to a range of mental and physical health conditions and health-harming behaviours, including depression, anxiety, cardiovascular disease, diabetes, stroke, alcoholism, and drug abuse. As the autistic child matures into adolescence and adulthood, the ongoing burden of anxiety and hypervigilance exerts a cumulative impact on physical and mental health. Consider a typical day in an autistic person's life. Most likely, they'll be in a busy environment and among other people. Other human beings are a massive source of sensory input. They wear brightly coloured clothes, they wear patterned clothes, they wear perfume or aftershave, they talk, laugh and make noise, they make eye contact. And all of this takes place in buildings typically full of hard surfaces that reflect sound and light. The frequency of potential sensory trauma is the third core characteristic. And along with the latency and ordinariness of potential sensory trauma events, it means that for many autistic people, the experience of sensory trauma may be unavoidable.
So yeah, the frequency and ordinariness of events that may cause sensory trauma mean that on a day-to-day basis, sensory trauma may be an inevitable part of normal life for many autistic people. However, exactly when sensory trauma might occur is paradoxically largely unpredictable. This unpredictable predictability means that sensory trauma cannot be readily avoided by autistic people in the normal unfolding of our days. For me, the expectation, anticipation, experience and effects of sensory trauma are woven inextricably into my days. So this makes going anywhere new or trying a new experience very difficult. Even with all the planning and structure that I put into place to help me manage better, sensory trauma is inevitable. Even with the self-soothing and regulating activities I proactively use to help me reduce or increase sensory input so that I'm regulated, things like wearing noise-cancelling headphones or stimming or using a fiddle toy, the only thing I can be pretty sure of every day is that something will happen that is likely to cause me sensory distress, and this may lead to me experiencing sensory trauma. So I'll hand over to Rory now for the final core characteristic of sensory trauma, which is that it may go unrecognised or be misidentified.
Think back for a moment to our earlier slide about the slamming door and the different reactions of the two people. There was me, who looked up at the noise, felt a bit annoyed, but carried on with what I was doing, and Emma, who experienced severe auditory pain, lashed out and fell to the floor. If I didn't know Emma, I may well have wondered what on earth could have distressed her so much. I certainly perceived the door slamming, but if I judge its effect on Emma using my own experience as a guide, I risk mislabeling Emma's response. Someone who didn't know that Emma's brain processes sensory information differently might have interpreted her reaction to the slamming door as over-responsive or hypersensitive. Non-autistic people may not even perceive certain types of sensory information in the environment, such as noise from a distant room, a subtle change in the gradient of the floor, or an irregularity in the wallpaper pattern. As such, they may not understand or even believe the autistic person's response to this kind of sensory information. They might consider that the autistic person overreacted or became distressed over nothing. From this kind of partial understanding, it is but a short step to pathologizing the autistic person's way of being in the world, or labeling it as challenging behavior, so-called challenging behavior. Remember, we have been considering autistic responses to sensory information that are involuntary. We are talking about autistic people perceiving threat to their safety and reacting with a survival response. When a person is in a physiological state in which fight, flight, or freeze are the only options, they have no access to their social engagement system to explain or to reason their way out of a situation.
And the impact of other people mislabeling or misunderstanding my personal sensory experiences has been immense, and I'm sure it'll be similar for many of the people listening to this talk. And first and foremost, when people fail to recognise my sensory trauma, they fail to treat me compassionately or validate my genuine experiences. And then there are further consequences: bullying, health harming behaviours, misdiagnosis, unwarranted medication and medical interventions. And then for other people, there may be arrest or imprisonment or compulsory detention under the Mental Health Act. So the long-term effects of misunderstanding or mislabelling sensory trauma can be catastrophic. I think that's part of what drove us to do this work. So let's spend a moment considering the lifespan of a made-up autistic person. So this year's theme at Autscape is growing, learning and developing. So I'd like us to consider life as an autistic baby. So here we have a baby, which is actually me, the picture. So whether you're an autistic adult or an autistic infant, the events of potential sensory trauma will be all around you in your everyday life. So let's consider some of the sensory experiences that most babies are likely to come across. So we've got being cuddled or held, which involves touch and proprioceptive input. And if you're being rocked by your caregiver, there is vestibular input too. And on top of this are all the noises that people make at you when you're a baby, along with the smell of people's perfume or aftershave and how they visually look to you as well. Babies wear clothes, but a plain coloured elasticated sleep suit in a soft jersey material will offer a completely different sensory experience to, say, a lacy patterned loose fitting dress that rustles when you move. Feeding. Feeding involves us recognising the interoceptive signals of being hungry and then communicating that to our caregivers by crying. So being breast or bottle fed may involve being held closely and having the sensation of a nipple or teat in your mouth, and sucking and swallowing needs to be coordinated, and the milk will have a taste and a warmth and a physical presence on your tongue. So these are just 3 examples of everyday experiences that all babies have, and there are many more besides. So every single one of these sensory experiences, whether it is feeling hungry or being rocked or wearing clothes, will be experienced differently by every baby. So autistic babies may experience those sensations more intensely or in more muted ways, and sometimes they experience them in similar ways to other babies. And perhaps one autistic baby experiences the sensation of being gently rocked and cuddled as incredibly soothing and regulating, and quickly finds comfort in its caregiver. Whereas a different autistic baby may need lots and lots of rocking and cuddling to have the same soothing effect, or perhaps will never reach those levels of comfort. And then another autistic baby may find the sensation of being held and moved about so distressing that they actually feel seasick and they can't bear to be picked up. So those babies that experience being rocked and cuddled as too intense, or who experience the sensation in a very muted way and need more input than their caregiver would reasonably expect to give, may come to associate being picked up by other people as a negative experience that causes their tiny body to respond as if under threat. So I'll hand over to Rory, who will explain a little bit about how our bodies and brains respond to the threats in the environment.
Thanks, Emma. Humans typically respond to threat in one of three ways: fight, flight, or freeze. These survival responses are facilitated by our autonomic nervous system, or ANS. Our ANS is always working away in the background, keeping our organs, hormones, breathing, and lots of other autonomic functions fine-tuned and ready to respond to whatever is going on inside and outside of our bodies. The standard model of the ANS describes two branches: the sympathetic branch, known as the sympathetic nervous system, or SNS, and this branch gets us ready for action. It triggers the fight or flight response in a number of ways, including increasing our heart rate, sending blood to our muscles so we can run away or defend ourselves. The parasympathetic branch, or parasympathetic nervous system, PNS, acts like a brake on the SNS. It reverses the effects of being ready to fight or run away and gets our bodies prepared for rest, digestion, and sleep. Developing this standard model of the ANS, polyvagal theory proposes that when we perceive threat, the PNS responds first by activating our social engagement system. This means using pro-social behaviours like eye contact, tone of voice, and negotiating skills to deal with a threat. Sometimes this strategy is not effective, and sometimes it is not relevant because the threat is physical. In these situations, our nervous system activates an SNS response of fight or flight, and we get ready to shout, punch, or run away. And finally, if SNS activation fails to deal with a threat, we descend into a PNS freeze state, where we might collapse or become disconnected or immobilized. In the course of their daily lives, autistic people, like non-autistic people, spend time in the company of others. However, as a function of their sensory differences, the social interactions autistic people take part in may feel threatening and unsafe, with the result that autistic people may be unable to access their social engagement systems. As we've seen, autistic babies may have sensory experiences so intense that they feel painful, or so muted that they barely register. Frequent and unavoidable exposure to potential sensory trauma over the course of their day means that autistic babies may be unable to pick up cues of safety from their caregivers, responding instead with a fight, flight, or freeze survival response. Fluctuating between these various survival responses all day long may leave the autistic baby's tiny body experiencing impacts such as increased heartbeat, perspiration, and disconnection from their caregivers. The baby may well experience a constantly changing mixture of all these responses. The baby may only occasionally experience a state of connection or safety with their caregiver, or perhaps they may not experience this at all. Caregivers may be full of love for their baby, desperate to connect with them, and willing to try anything. Through trial and error, they may find a variety of innovative ways of providing comfort. For a baby experiencing sensory trauma, changes to the caregiver's style of interacting with them may make it even harder, if not impossible, for them to connect. These changes are inspired by a desire to connect, but they may have the opposite effect. If the caregiver becomes more interactive and energetic, the baby may possibly experience this as further sensory trauma, with the result that their social engagement system may become or remain unavailable to them. If the caregiver withdraws affectionate touch because they feel rejected by the baby, an outcome may be a compromised relationship between the two, because both are missing out on the co-regulating effects of affectionate touch, and the caregiver may feel rejected or inadequate to meet the baby's needs. The caregiver's only aim and desire is to connect and engage with their baby and give them the kind of loving care they know the baby needs in order to grow and develop and thrive. However, the result may be that connection, co-regulation, and attunement between baby and parent fail to develop.
5 minutes to go.
Thank you. So we've got a baby growing up in an environment where the world doesn't feel safe, and its interactions with other people are inconsistent and don't provide the regulating, growth-promoting parental input that babies need. And that's not to say that the baby never experiences regulating intimacy from others, but these engagements may come to be the exception rather than the rule. And this inconsistent parenting, and by inconsistent, I mean in the way that Rory's just described, where parents who in most cases have loving intentions but alternate between different interaction styles because they aren't aware that the sensory experiences of their baby are so different to their own sensory experiences. This type of inconsistency may result in weak or lack of secure attachment between infant and parent. And without this experience of consistent regulating nurture, the baby will be left to manage their sensory trauma alone. So the baby may respond to stress by fluctuating between survival responses. In practical terms, this could be the infant developing an autonomic nervous system bias towards SNS, hyperarousal, those fight and flight responses, or towards PNS, disconnection, those freeze responses. And this can result in an infant very quickly responding to perceived threats by experiencing heightened fear or terror, or through disconnection and immobilization. And when people are exposed to trauma as babies and children, there is a potential effect of influencing how the brain is permanently organized. And this can affect future functional capabilities and how the person develops and learns. Adult experiences can also change the brain, and of course the neuroplasticity of our brains means that we have the potential to find new ways of learning and adapting throughout our lives. It's not all negative. So our baby grows, they develop, and they may begin their education, and I don't need to list some of the challenges we face as autistic children in the education system. Schools include all the elements of potential sensory trauma. And when we're dysregulated or under stress or hypervigilant or dissociated, we're not able to learn to our best abilities. The social challenges children face may be influenced by being in a state of hypervigilance. If we remember, if our brain and body perceive something in the environment as a physical threat, we're unable to access our social engagement systems. I'll stop screen sharing there. Okay, so sensory trauma has a profound effect upon autistic people's growth, development, and ability to learn. And there are the physical effects that we've just described, as well as the effect of other people's misunderstanding and the mislabeling and the disbelief that we shared earlier. And Rory and I frequently discuss how we can make the world a better place for autistic people and for all people. And as we've seen, sensory trauma derives from the interaction between the individual and the physical and social environment. And in the light of this, there is a need to bring relationships and their development to the forefront of collaborations between autistic and non-autistic people.
We need to emphasize reciprocal relationships in which both partners give and take. And only then might we begin to forge ways of working together that are equitable and thereby successful.
And here, reciprocity is not the same as teaching or training or mentoring or general caregiving. Rather, it should be understood as the intentional, active process of sharing the other person's world, for me to see the world through Rory's perspective, and for him to see it through mine.
This kind of reciprocity asks of both communication partners some degree of letting go and simultaneously of opening up. And this may not be straightforward for either person, as what is being asked of each of us is to intentionally, actively change our way of being in the world.
However, the rewards of this mode of collaboration for both communication partners may be considerable and lasting.
As the author Phoebe Caldwell, who some of you may have heard of, as Phoebe reminds us, in being for each other, we become ourselves.
One last slide that I'll just share here. Okay. So I'd like to say thank you for listening to our presentation. I think we've just about managed to keep to time, which I'm really pleased about. So going clockwise around this slide, you've met myself, top left, and you've met Rory, and I think we're looking a bit younger on those slides than we actually are. And then next we have Rachel, and then finally we have Kate. And Kate has created all the amazing and original drawings that we've used in our slides, and also in Autism Wellbeing social media posts, booklets and resources. So we hope you've enjoyed the presentation. I'll stop screen sharing, and we're happy to take any questions, or if you just want to make a comment, that's fine. And if we can't answer them now, we'll come back to them on Discord or arrange something later in the week.